He was scared, alone, and in pain. The nurse didn't need to say much. She held his hand and said gently, "I'm here for you." At that moment his heartbeat steadied. This is communication in nursing, and it's more powerful than we think. In a hospital, communication isn't just about talking. It's about listening, understanding, and guiding. A nurse is not just a caregiver, she's a translator between fear and clarity. When nurses communicate well, patients feel safe. And when patients feel safe, healing begins. The first and most important skill, active listening. It means being fully present, looking at the patient, letting them finish, nodding, showing them, "Yes, I hear you." Sometimes, that's all someone in pain really needs. Next, empathy. Not sympathy, empathy. Understanding their emotions without judgment. Just saying, "I understand this is hard for you," can make a huge difference. Patients don't always remember our words, but they remember how we made them feel. Third, clear instructions. Forget medical terms. Be simple, direct, and repeat if needed. Instead of, "Take 10 milligrams of amlodipine twice daily," say, "Take this blood pressure pill after breakfast and dinner." Simple saves lives. Next, body language. Our posture, face, tone all speak louder than words. Crossed arms, rushed tone, the patient feels ignored. But open hands, eye contact, and a calm voice, that says, "You matter." As nurses, we face stress and sometimes even anger. Families are scared. Patients are frustrated. The key is to stay calm, use kind words, and never take it personally. Say things like, "I understand this is frustrating. Let me help." You're not just solving problems, you're calming storms. Let's look at 2 examples. First, poor communication. The nurse rushes in, gives instructions without looking at the patient, then walks away. The patient feels lost and ignored. Trust broken. Now, good communication. The nurse sits down, speaks gently, and explains everything slowly. She writes it down, and checks if the patient understood. Result: trust, comfort, clarity. Let's recap the 5 golden rules of nurse communication. 1. Listen actively. 2. Show empathy. 3. Give clear instructions. 4. Use positive body language. 5. Stay calm in difficult situations. Communication is not just a soft skill, it's a clinical tool. With your words and presence, you can reduce fear, build trust, and even save lives. Are you a nursing student or practicing nurse? Tell me in the comments, which of these 5 skills do you use most in your practice? Like, share, and subscribe for more nursing wisdom and real stories from the front line. Because nursing is not just about medicine, it's about care, compassion, and communication.